President and CEO, Mississippi Hospital Association, Kim Hoover, join us in the Trustmark studios. Trustmark, life's beautiful when your bank fits you to a T. People you trust, advice that works. To learn more, go to trustmark.com, member FDIC. Tim, good morning, sir. How are you?
Good morning, Paul. Doing well.
And Kim,
well. Thank you for allowing us.
Good morning to you. How are you?
I'm well, thank you.
Thank you guys for showing up. I appreciate you gracing the studio this morning. Man, lots to talk about. So far, let's see, the House comes in. This is when your antenna goes up and you know, okay, I got to start worrying now. The Senate gavel's in at 3 o'clock. The House gavel's in at 4 p.m. For you folks who don't know, Kim Hoover is COO and CEO of Mississippi Hospital Association's Education Foundation. Is that right, Kim? Did I get that right?
COO for the MHA and CEO for the foundation, yes.
I got you. All right. I think we both understand that we have a crisis here. Tim and I have talked about this before. Yeah. And as always, we like to hear people who come up and say, all right, here's what these solutions are, even though they may sting a little bit, Tim. So take it from there.
Yeah, and I'll just a couple of comments. And I tell you, Kim has been working very closely with this since early in the pandemic. We knew the issues were coming, and of course, we've been very open about them. We've talked about them. You and I, as you just mentioned, have had a number of conversations about it. And that issue has not gotten better. It's only gotten worse. We see no signs of it improving. And I tell you, a terrible misconception, Paul, is the fact that if we see the numbers for COVID going down, but yet we don't see a decrease in the need for care. Mm-hmm. So our hospitals are still experiencing high volumes, even without COVID, and we have to have staff to try to take care of them.
Go ahead.
No, I was going to say, and Kim has been doing a number of things with a number of different agencies and schools and hospitals that I think you'll be very impressed with.
Kim, I think some of the numbers we were talking about earlier, and I read this in some of the show prep, we have over 3,000 registered nurses vacancies in the state. Over 3,000 registered.
Just
the hospitals.
Just
right.
hospitals.
That's correct.
Speak to that, Kim.
All right. So the number of vacancies, the RN vacancies, have continued to climb as RNs leave for a number of reasons. Many of them have left to work for travel agencies. Some have simply said, I'm not going to do this anymore, and decided to take a different path in their career. Others have said, I'm going to retire early and just not do this. Some have gone to ambulatory care clinics and that sort of thing. But, I think you have to think about those 3,000, over 3,000 RN vacancies, in addition to the number of nurses who are out for their families. They're sick, either with COVID or they've been exposed, or other illnesses, too.
See, it's almost like that perfect storm type thing. Everything's happening at the same time. Yeah. Tim, I know, and I mentioned this a little bit earlier, it seems like in my life and career, we've had so many interviews over the many years, and there was almost like we're having difficulty getting into a nursing school because there are no vacancies. We don't need any more nurses. And then that cycle happens the other way. Is that the right perception? And if that's the case, when will this thing turn around?
Go ahead, Kim.
Anybody.
Right now, we are talking with schools of nursing. There are the schools of nursing, before they can and have more students, have to have places for those students to be able to train. The education for nursing students is held primarily in hospitals. And if you don't have staff in hospitals, then you are unable to take nursing students in. And so that is the crisis right now that we are seeing that is so very different from what we've seen in the past.
So how many hospitals can they, in other words, there are just a few hospitals that will permit the nurses training in their facilities. Is that what you're saying?
No. Well, the hospitals will permit nurses to come in, but there are criteria that have to be met. And so there have to be nurses there to help with the students. And if they don't have enough nurses, so for example, if a hospital's been able to take 150 students in, they might only be able to take 50, 20, 10 Some are limiting the places where these students can go. They're trying. Last year, over 500 nursing students were actually hired in hospitals to be able to help out. But the schools of nursing right now are, and we have a number, we have 23 programs in the state, I believe, both associate degree and baccalaureate. And I just learned that their applications for the fall have declined slightly. So typically we do have a lot coming in, but in this case, there's been a lot of negative comments, and younger people that's not the career right now. Some are
it's a culture change. I understand that. As far as any of the laws that are existing, Tim, is that something that could be alleviated or lessened with the legislature in 2022? Anything that they could help out with?
Yeah, certainly, Paul. I think, and I think they're trying. They're looking at some different options. We have proposed some options. There are bills out that are actually directing money back to the associate nursing programs to incentivize those with tuition. The tuition reimbursement program has been put back into place. There are a number of things that are out there, but there's even a greater concern because hospitals have to be a huge part of fixing this problem. And currently, their financial situation is so critical that they're going to be very limited on what they can do. As Kim was saying, there has to be staff, there has to be nurses in place to help coach, to mentor, to train new nurses coming on. And if a hospital is stretched with the amount of staff that it has, then there's no way they can take on additional nurses to train. So it's
wait a minute. You're bumping into some common sense here because it sounds like you've just gone over into a political thing here. But it seems to me if you have additional interns on premise, on the floor there, that would help not exacerbate the problem, but it would help the problem a little bit.
Well, not if they're not trained in what to do.
Well, if they're being trained, though, they wouldn't come in with absolutely zilch. Wouldn't they have some training?
Academic training and clinical training are two entirely different things, Paul.
I understand that.
And that's what comes into play when you get in a hospital. Now, you can have somebody that has a excellent student, above average student in academics, and if they have not touched a patient, it is a very difficult situation. I can go back to my clinical days.
Do we? And that comes to mind. Candy stripers. Remember that?
Absolutely.
Do we still have those?
Volunteers. We still have volunteers.
They're volunteers, basically. Yeah.
Yes.
Where do LPNs fit into this whole issue here?
I think they have a significant role, particularly in our facilities of nursing homes and assisted living facilities. But even beyond that, Paul, years ago, Kim and I have talked about this. Years ago, we approached nursing from a team concept. You had a nurse's aide, CNA, you had LPNs, and you had RNs. They were given a group of patients, and each one practiced up to the limits of their scope of practice, of what they were trained to do. Yeah. And we kind of got away from that. And I'm not saying it right, wrong, whatever it was, but we got away from it. And we started moving, the payers, the public, everybody wanted to move away from inpatient care. And so the payers stopped paying for it. So all of a sudden we start decreasing, and hospitals have gotten blamed for this, for decreasing the number of staff in hospitals. Yeah. Well, the reason they decreased it because there was less work to be done there. It was all moved to an outpatient basis. And when you do that, you change the core curriculum or the skill set of those nurses and other caregivers, not just nurses. We're talking about a lot of different people here, even beyond nurses. And we have to go back and re-look at how do we remold this thing, because we're going to have to change it, because we're going to change the way we do it, because the circumstances are not going to change anytime soon.
Are most of those changes up to the hospitals in the state to do that, or most of those come with under the directives of a new law, new statutes, new whatever it happens to be by the legislature?
You know, a lot of that can be done working with the Board of Nursing and working with and under a regulation standpoint.
But they have failed to do it so far.
But they've done some. They've done some, and we can talk about that, yes.
We do have some squirrely laws. I'll mention one when we're coming back as far as health care is concerned, and we'll talk more coming up in a moment or two, resuming the conversation with Tim Moore and Kim Hoover Foundation. There are some strange rules. We got later on in this week, we'll have an interview with a couple of guys to talk about the paramedics and EMTs. And just to throw out this, I didn't realize this, a paramedic or an EMT cannot practice outside the scope of an ambulance. In other words, if a paramedic or an EMT with the training that they have, certainly a paramedic, wants to be employed by, let's say, Nissan within their confines or a casino or anywhere else, they're not permitted to do that and call themselves a paramedic.
Right.
And it's one of the few states. If I'm trying to think of another law in another area of the private sector where that would be applicable, and I cannot. So we'll talk about that a little bit later on. What's the solution here? Either of you guys.
Well, so some of the things that we've been working with the chief nursing officers and the schools of nursing, and really talking with the Board of Nursing too. So the Board of Nursing has allowed nursing graduates to have a temporary work permit. When I graduated from nursing school, that was allowed before we took boards because we didn't take boards so quickly. So allowing those graduates to have a temporary work permit means they can get into the hospital sooner and get some orientation over before they take boards, and literally they're ready then to hit the floor. We are looking at both a preceptor and mentor academy and a clinical faculty adjunct academy where we're helping to train. We've got a new workforce now that'll be coming into the hospital. And to be able to bring new nurses in with nurses who've only been out a year or two means that they need some training around precepting. They need to know what it is that they can do to bring that person on board, to help them with their skills, but also just help to orient them. And the other is to allow the staff already in the hospital to function as clinical faculty so that they are they work with the School of Nursing, they also work for the hospital, and they can then take groups of students into the clinical area and be very comfortable in that area, know how to teach them, know how to evaluate them, and that actually is a partnership that's been working for some time in other states as well.
Yeah, so Paul, what you're looking at is you're looking at a supply problem. So you increase the supply and meet the demand, of course. And then there are real potentials here, as Kim and I were talking about during the break, some real innovation. Our hospitals are going to have to get creative. Our nursing workforce is going to have to get very creative in the fact that how do we now provide care in an entirely different model from what we've ever seen? And we're transitioning from one that was a very high labor-intense approach to, is there technology that we can put in place and take advantage of? Yeah. But we cannot undersell the critical need for help from the legislature to address these issues as quickly as possible. The urgency here has not changed, and we're tickled to death over the lower numbers. We want to see lower and lower numbers, but if we talk to our hospitals, they repeatedly tell us that volume is not an issue. We have volume. Our problem is costs have gone up 2.5 to 3 times, not percent, Paul, times what they were pre-COVID. So
how does our pay scale, Kim, compare to the surrounding states? That's another thing. Almost like teachers is some of the lower.
We're actually at the very bottom.
Yeah.
I think the last I saw that we were at 48th. And so our pay scale has been low for quite some time now, certainly when you compare it to other states. If you look at Texas in particular.
What are we talking about for an LPN versus a registered nurse?
Well, the registered nurse salaries before the pandemic were $25 to $35 an hour, and that just depends on the level of skill. Well, and now they're trying to pay. The only way really to get some of these nurses in is to pay premium pay, and some are paying as much as $80 an hour, and then someone in Tennessee, for example, might offer $120 an hour. And so even premium pay that honestly they can't afford doesn't mean they're going to be able to keep those nurses. So there 5 or 6 nurses might leave at one time. Yeah. And patients are backed up in the emergency departments, and so they're taking care of acutely ill patients on the floors now. And they
Are you guys going into the schools, 10th grade, 11th grade, certainly 12th grade, and at least trying to paint a good picture of this as far as the income, being able to stay in Mississippi, et cetera?
That's actually one of the things that we were talking about doing. That was, we've got a sort of a media campaign planned, and we really right now need to hit seniors and those who are early on in their college, because we need, I mean, we're still looking at 2 or 3 years out, to even get some relief in that way. But we are going to need to paint a positive picture, not just of nursing, the salaries that you can make, the career mobility, but working in a hospital, what that's like, and the satisfaction that you can get from that.
Yeah. Can you do, is it a 2-year program as far as LPNs? And explain that a little bit. How long does it take?
So the LPN program is typically an 11-month program. And for the registered nurse out of an associate degree program, that is typically a 2-year program, although they have to have some prerequisites. And it's a 4-year program for a baccalaureate, a BSN.
Yeah, and so the LPN can step it up to the next degree. Or
absolutely. There are LPN
and most do
programs.
that. Yeah. What do other states do, Tim? I mean, we're not the only state facing this. Do they do, I don't know, loan forgiveness as far as education is concerned, or in some type of program such as that?
Yeah, all of the above, Paul. The group that I work with, my counterparts across the state, are all in the process of doing the same things we are. And of course that really sends our situation to even another level, because you can't pull nurses from another state because they're all trying to pull them from somebody else.
That's true.
So we understand that. We know we're cannibalizing each other, but our hospitals and our citizens need care. So everybody's trying to get nurses.
Do we have traveling nurses here in this state now? And how many do we have?
We do. I don't know if we've got a number.
We don't have a number, and in fact, because we have compact licensure where nurses can go to other states and work, we don't really have a good method of keeping up with that. Right now, nurses, we do have some travel nurses in the state. Most of them are going to other states because the salaries are higher there.
Paul, I had a hospital administrator call me 2 weeks ago and said, I've got 17 nurses leaving on May the 1st, I believe it was, when the contract went out. Travel nurses that had expired their contract and they were going somewhere else. Take a 17-nurse hit out of an ICU unit at one time.
That's incredible. What's the average salary of that, or the average cost of a traveling nurse in Mississippi?
So right now, what we're looking at is about $120 an hour. Some are able to get, and that depends on if you're, of course, that's the same. The respiratory therapists are $100, $120 an hour as well. So if you're looking for a nurse to work on a general medical surgical unit, that's less. But ICU and emergency department nurses are running at least that much, if you can get one.
And that's average. That is an average.
Yeah. Do we have more guys beginning to come back into this field? Once it started off at all guys, and then it kind of, the ladies took it over. But do we have more males coming back into it?
We actually do have.
I didn't want to get into a Clara Barton thing here.
Wise move.
I like that sentence. We took it over. So we actually do. There are a number of males in the profession, and they continue to increase. And so that's not really been an issue. There are both males and females come into the program. Males go into. There are a lot who go into emergency medicine, flight medicine, ICU, and that sort of thing. But yes,
anesthesia.
And anesthesia, correct.
Yeah, and that's another thing. There's so many different pediatrics and everything else. There's so many different areas, but that's one of the reasons. And I if it's this or anything else, we have got to have career day about every week, not once or twice a year. We have got to, if we want to sell these to these kids at 10th, 11th, and 12th grade, and maybe even earlier, we've got to be there. So. I mean, this is something that we have to do in our education system.
Now, I think you're spot on, and I think earlier is even better. Yeah. I think we've got to back up to probably 8th, 9th grade.
That's exactly right.
And so they have a little concept of it, and we need to start the education process at that point.
Yeah. probably we're three, us three right here, are the only ones who decided what we wanted to do and never changed our mind from the seventh grade. Hey, Tim, congratulations, sir. It's the first time we didn't talk about Medicaid expansion.
Hey, it's early. It's early.
We'll have you back on. Kim, it was nice to meet you. No kin to a guy down in Brookhaven, are you?
I'm not. Oh, Alvin. I'm not, but he's a great guy.
He is a good
We
guy.
often get them confused, though.
Yes, that's
I know.
true.
Oh, really? Thank you, guys. Appreciate it very
Thank you,
much.
Paul.
Very informative. Look forward to talking to you again.